Bismillahirrahmanirrahim. Today we will discuss about electroencephalography. Electroencephalography. Electroencephalography is recording of the electrical activity of the brain by placing electrode on the surface of scalp. So recording of the electrical activity of the brain by placing electrodes on the surface of the scalp. So we place electrodes on the scalp surface and we record the electrical activity of the brain. The record obtained is electroencephalogram. So electroencephalogram is the record of the electrical activity of the brain. And the apparatus is called electroencephalograph. So electroencephalograph is the apparatus used to record electrical activity of the brain. Sometimes we record electrical activity of the brain by placing electrodes directly on the surface of the cerebral cortex. So sometimes we record the electrical activity of the brain by placing electrodes directly on the surface of the cerebral cortex, such as in experimental animals, and in human beings during neurosurgical operations. Electroencephalogram or EEG. So EEG was first recorded by a German psychiatrist in 1929 by Hans Berger. Hans Berger was a German psychiatrist who for the first time recorded EEG in 1929. So Hans Berger was the first person who recorded EEG in 1929, and he was a German psychiatrist. EEG may be unipolar or bipolar. In unipolar EEG, one electrode is active and placed on the surface of the scalp. Right? So one electrode is active and is placed on the surface of the scalp. The other electrode is inactive, indifferent, and placed at a distant point in the body, say tip of the 7th cervical vertebra. EEG recording may be bipolar, in which both the electrodes are active. So in bipolar EEG recording, both the electrodes are active, and these are placed on the surface of the scalp. EEG electrodes are placed on the scalp, in frontal, parietal, occipital, and temporal regions. So EEG electrodes are placed on the scalp in frontal, parietal, occipital, and temporal regions. You see, this is the placement of these electrodes. Frontal, temporal, occipital. This is the temporal, occipital. This is temporal. You see the placement of electrodes in this figure also. This is the frontal region, parietal, occipital region, and this is the temporal region. We place about 20 electrodes. So about 20 electrodes are placed on the skull to record each. So about 20 electrodes are placed on the skull, to record each. You can see the EEG record of different EEG reads. You see the EEG record. Right? Normally in the EEG, 4 types of waves are recorded. So 4 types of waves are recorded in the normal EEG. Alpha, beta, theta, and delta waves. You see? Alpha, beta, theta, and delta waves are normally recorded in the EEG. We'll discuss about these EEG waves. Alpha waves. Alpha waves, their frequency is 8 to 12 cycles per second, and voltage, their amplitude is 50 microvolts. So 50 microvolts is the voltage or amplitude of alpha waves, and frequency is 8 to 12 cycles per second. Alpha waves are recorded when a person is in a quiet room. When the person is in a quiet room, his eyes are closed, and he is mentally relaxed. He is mentally relaxed. So the person is awake, but he is quiet, mentally relaxed. The room is quiet. So alpha waves are the waves of quiet wakefulness. Quiet wakefulness or inattentiveness. So alpha waves are waves of quiet wakefulness or inattentiveness. So keep in mind that alpha waves are the waves of quiet wakefulness or inattentiveness. These are best recorded in the parietal and occipital regions. Best recorded in the parietal and occipital regions. Alpha waves disappear when the person opens eyes. When the person opens eyes, alpha wave disappear. Or when brain becomes active. When brain becomes active, so the person starts concentration, starts thinking, starts solving some arithmetic problem, or there is some sensory input, then alpha waves disappear. Alpha waves disappear when the person opens eyes or brain becomes active by some sensory input, sensory stimulation, or the person starts thinking, starts concentrating, starts solving an arithmetic problem. So alpha waves disappear when eyes are open. So when eyes are open, you see alpha waves are replaced by a desynchronized low voltage waves. And eyes are again closed, again alpha waves appear. Alpha rhythm appear, alpha waves appear. Frequency of alpha waves decreases. Frequency of alpha waves decreases by hypoglycemia, decreased body temperature, decreased glucocorticoid level, and increased PCO2. Frequency of alpha rhythm decreases by decreased body temperature, hypoglycemia, decreased glucocorticoid level, and increased PCO2, partial pressure of carbon dioxide. The voltage amplitude of alpha rhythm, is 50 microvolts, relatively larger waves. And this shows that alpha waves are recorded when brain electrical activity is synchronized. So this greater amplitude, greater voltage indicates that the alpha waves are synchronized waves. The electrical activity in the brain is synchronized. It is synchronized. So this was about the alpha waves or alpha rhythm in the EEG. Now we come to the beta waves. Beta waves, their frequency is 13 to 30 cycles per second. So frequency of beta waves is 30 to 30 cycles per second. And their voltage is 20 microvolts. So 20 microvolts is the voltage of the beta waves. Beta waves indicate highly active brain. So beta waves indicate highly active brain. When brain is highly active, beta waves are recorded. Beta waves are also recorded during REM sleep, rapid eye movement sleep. So also recorded during REM sleep, REM sleep, or rapid eye movement sleep. So beta waves have low voltage. Beta waves have low voltage, 20 microvolts. And this indicates that beta waves are recorded when electrical activity in the brain is desynchronized, asynchronized. So when electrical activity in the brain is asynchronized or desynchronized, beta waves are recorded in the EEG. So beta waves indicate highly active brain, and these are also recorded during REM sleep, rapid eye movement sleep. Now we come to theta waves. Theta waves, their frequency is 4 to 7 cycles per second. Frequency is 4 to 7 cycles per second. And their voltage is 10. Their voltage is 10 microvolts. So 10 microvolts is the voltage and frequency is 4 to 7 cycles per second. In adults, beta waves are recorded during light sleep. So during light sleep, beta waves are recorded. Beta waves are recorded during emotional states such as frustration, disappointment, These are also recorded when there is degenerative brain disorders. So when there is some brain disorder having degeneration, theta waves are also recorded. So in adults, theta waves are recorded during light sleep, during emotional state, emotional stress, say frustration, disappointment, and also in brain disorders having degeneration. In children, theta waves in children, theta waves are recorded during wakefulness. In children, theta waves are recorded during wakefulness. So this was about the theta waves. Theta waves are best recorded from parietal and temporal region. So theta waves are best recorded from parietal and temporal region. I would add, beta waves are best recorded in parietal and frontal regions. So beta waves are best recorded in parietal and frontal regions. Theta waves best recorded in parietal and temporal region. Now we come to delta waves. Delta waves are very large waves and slow waves. Their frequency of delta waves is 0.5 to 3 cycles per second, and their voltage is 100 microvolts. So frequency of the delta waves is 0.5 to 3 cycles per second, and their voltage amplitude is 100 microvolts. Delta waves are recorded during deep sleep. General anesthesia, coma, unconsciousness, and also during epilepsy. So delta waves are recorded during deep sleep, general anesthesia, coma or unconsciousness, and brain disorders such as epilepsy. So this was about the EEG waves, alpha, beta, theta, and delta waves. Now we come to the physiological basis of EEG. Physiological basis of EEG. Electrical activity recorded in the EEG is the electrical activity in the superficial parts of the cerebral cortex. Electrical activity recorded in the EEG is the electrical activity in the superficial part of the brain or cerebral cortex. You know, in these superficial parts of the cerebral cortex, there are few cell bodies. There are few cell bodies in superficial layers of the cerebral cortex. Mostly they are dendrites and nerve fibers. Mostly they are dendrites and nerve fibers. On dendrites, a large number of synaptic knobs, synapse. So a large number of synaptic knobs terminate on the dendrites to form synapses. So a large number of synaptic knobs terminate on the dendrites to form synapses. Some of the synapses are excitatory and some are inhibitory. Some are excitatory synapses, others are inhibitory synapses. At excitatory synapses, there is generation of EPSP. So at excitatory synapses, there is generation of EPSP, excitatory postsynaptic membrane potential. Excitatory postsynaptic membrane potential. At inhibitory synapses, there is production of IPSP, and that is inhibitory postsynaptic membrane potential. Inhibitory postsynaptic membrane potential, or IPSP. So EPSP is produced at excitatory synapses. IPSP is produced at inhibitory synapses. Electrical potentials recorded in the EEG are the summated potentials of EPSP and IPSP. So electrical potentials recorded in the EEG are the summated EPSPs and IPSPs. So EPSPs and IPSPs summate to give rise to the electrical changes, electrical potentials, which can be recorded in the EEG. Voltage of EEG waves. Voltage of EEG waves depends upon how much synchronized is the electrical activity. So voltage of EEG waves depends upon how much synchronized is the electrical activity. If electrical activity in different parts of the brain is synchronized, I mean deflections are produced in same direction. Deflections are produced in same direction, then these are summated. These are summated, and the amplitude or the voltage of the waves increases. So when electrical activity in the brain is synchronized, the voltage or amplitude of the waves is high. So high amplitude, high wave voltage when there is synchronized electrical activity in the brain. When electrical activity in the brain is desynchronized, asynchronized, deflections are in opposite directions. Deflections are in opposite directions when there is asynchronized or desynchronized electrical activity in the brain. And deflections in opposite directions neutralized, cancel each other. And this gives rise to low voltage, low amplitude of the EEG wave. This gives rise to low voltage or low amplitude of the EEG waves. Keep in mind that electrical activity of a single neuron or a single nerve fiber is not sufficient to be recorded in the EEG. Electrical activity of a single neuron or a single nerve fiber is not sufficient to be recorded in the EEG. It is the simultaneous electrical activity of thousands of nerve cells or nerve fibers which get summated to be recorded in the EEG. So it is the simultaneous electrical activity of thousands of nerve cells or nerve fibers get summated so that it can be recorded in the EEG. Right? Alpha waves, which are the waves of quiet wakefulness or inattentiveness, these depend upon the thalamocortical connections. So alpha waves depends upon the thalamocortical connections. If thalamocortical fibers are cut, alpha waves disappear, delta waves appear. So when thalamocortical fibers are cut, alpha waves disappear, delta waves appear in the EEG. So this was about the physiological basis of EEG, electroencephalogram. Now we come to the clinical use of the EEG. Clinical use of the EEG. EEG reflects functional state of the brain. EEG reflects the functional state of the brain. EEG is recorded to investigate a patient. EEG is recorded to investigate a patient or for research purpose. EEG is recorded for many hours, recorded for the whole night or for the whole day. Nowadays, a facility is available for ambulatory EEG recording. Ambulatory EEG recording. The subject is moving around and her EEG is being recorded. So when EEG is recorded for, say, many hours, then it generates EEG paper of many kilometer length. And EEG is recorded, say, for many hours, the EEG record consists of EEG record paper of many kilometer length. But nowadays EEG machines are computerized, and these machines perform the analysis, right? And if any finding is there, it is shown by the EEG machine. I told you that EEG reflects the functional state of the brain. EEG silence, no wave is recorded in the EEG. EEG silence indicates brain death. EEG silence indicates brain death. And brain death is the accepted criteria for the death. Brain death is the accepted criterion of the death. So when no waves are recorded in the EEG, it is EEG silence. And this indicates brain death. And brain death is the accepted criterion for the death of a person. EEG has to study or to diagnose space-occupying lesion in the brain. So it has to diagnose space-occupying lesion in the brain. And this lesion may be infected. The lesion may be infected, vascular, traumatic, or maybe tumor. So EEG helps in the diagnosis of space-occupying lesion in the brain, which may be infective, traumatic, vascular, or a tumor. EEG also helps in the diagnosis of epilepsy and its type. It helps in the diagnosis of epilepsy and its type. So epilepsy and its types can be diagnosed by the EEG. You see EEG in different types of epilepsy. This is grand mal epilepsy, and you see large waves, high voltage waves in grand mal epilepsy. So high voltage waves in grand mal epilepsy. You see the EEG of petit mal epilepsy, spike and dome pattern. Spike and dome or wave, spike and dome or wave pattern. You see a spike, then there is a dome, D-O-M-E, dome, or wave. Again spike and dome. So spike and dome pattern in petit mal epilepsy. You see, this is the EEG in psychomotor epilepsy. So EEG in psychomotor epilepsy. You see slow rectangular waves in psychomotor epilepsy. Now, in many cases of epilepsy, EEG may not show any abnormality, but during the epileptic seizure or fit, if you record EEG, it may show abnormality. In many cases, EEG is normal in case of epilepsy. So during epileptic fit or seizure, if you record the EEG, it may indicate some abnormality. EEG also helps in the diagnosis of narcolepsy, a hypothalamic disorder, narcolepsy, encephalitis, sleep apnea syndrome, and many other disorders. So it helps in the diagnosis of encephalitis, sleep apnea syndrome, narcolepsy, and many other sleep disorders. So this was about the clinical use of the epilepsy, and that is for